Over 3,000 deaths in Arizona in just the past 2 years. The opioid crisis is, of course, a public health emergency, and it's already been classified as a disorder. So why not treat it like other diseases with a vaccine? Our Lindsay Reiser shows us what they're developing up in Flagstaff.
In the cool mountains of Flagstaff, the police have sensed an epidemic on their doorstep.
It's kind of scary when you think about it. You walk up to someone and they're limp. They're laying unresponsive, not responding to tapping.
Sergeant Charles Hernandez says they started carrying Narcan, the opioid reversing drug, with them on calls. They've had to use it twice.
Preservation of life is our highest priority in law enforcement.
This issue isn't unique to Flagstaff. Last year, nearly 10,000 people overdosed on opioids. But it could be a lab in Flagstaff that solves it.
And I think this is trying to help reduce that stigma, because in many cases, people who become addicted to opioids, it may not be necessarily their fault.
Naomi Lee and her team at NAU,
it's the yellow one,
are working with the University of New Mexico on developing a vaccine not for infectious diseases, but for opioid addiction.
We hope it will create antibodies against the opioid itself to prevent it from getting into your body, into your blood, and causing that high.
They're targeting oxycodone, hydrocodone, and morphine because chemically they're similar in structure.
It's going to help so many people in the long run.
It's a noble project that Lee agrees could not only have a societal impact, but one even closer to home.
I mean, I even have family members who haven't passed from opioid overdoses, but they have definitely struggled with it. And so knowing that I can immediately impact my family is one of the best motivations for me.
In Flagstaff, Lindsay Reiser for Arizona's Family.